All right, let's quickly review this randomized trial published in New England Journal of Medicine on tight glucose control versus liberal glucose control. My name is Mike Freilich. I'm a general internist and clinician scientist. So let's use the PICO framework to understand the study. So the population, critically ill adults, and they had to have at least 2 elevated glucose readings, and you can see the units and measurements here. The intervention was tight glucose control, so that would have meant that really you wanted to keep glucose between 4.4 and 6.1, or liberal glucose control, in which case you were not giving them insulin unless their glucose was elevated above 11.9 or 215 in American units. And the outcome was a length of time that ICU care was needed. The timeline was 90 days. This was not a placebo-controlled study. It was funded by a public research council. Outcome clinically relevant? Yeah, I'd say so. It was not blinded. It was intention to treat analysis, which is ideal. And this was a multi-center study, so a lot of centers here. Results, so in terms of the population, they screened 24,000 and randomized just over 9,000. Loss to follow-up was rare. Average age was 67, 63% were male, and 20% had diabetes. Most of the patients were in the ICU because they had a recent cardiac surgery. So this is probably the patient population where the results apply the most. So what happened? Well, as you can see here by this no separation in the Kaplan-Meier curves, there was really no difference whatsoever between the two groups. In terms of secondary outcomes, there were higher rates of severe hypoglycemia in the arm that got tight glycemic control. Interestingly, they also had lower rates of severe AKI or dialysis, but this is a secondary outcome, so this is really only hypothesis generating. Limitations of the study. So as mentioned, it was an unblinded trial, and certainly there were some issues with confounding, which could have occurred mainly due to the COVID-19 pandemic. Nothing that the authors could have done to fix this, of course. So in critically ill patients who are not receiving early parenteral nutrition, tight glucose control did not affect the length of stay. So certainly it does not feel like this is something we should be doing. And instead, I feel like liberal glucose control is probably the way to go. Thank you so much to Natasha Verhoef, who produced this video. She's a senior medical student here at the University of Toronto.